Good afternoon, everyone, and thank you for joining us today for this wonderful webinar on Smile Bright Discovering the Secrets of Optimal Dental Hygiene. So, I am delighted to be your host for this insightful session. So, where we will dwell into the world of dental care and hygiene with our true expert in the field. So, I'd like to introduce Mr. Dr. Sai Praneeth with over 16 years of invaluable experience in the field of dental services. He stands as one of the leading laser specialists in India. His passion for raising awareness about the dental health and his dedication to educate individuals and patients on oral hygiene, dental treatment, and their advantages is truly commendable. As the head of our national dental panel and with numerous publications in esteemed journals such as the Journal of International Oral Health, Dr. Sai brings a wealth of knowledge and expert to our webinar today. So throughout the session, we will explore the importance of maintaining optimal dental hygiene and will also uncovering the values, insight, and the practical tips that can help you achieve a brighter, healthier smile. So, without any further ado, let's embark on this enlightening journey with Dr. Sai.
Thank you, Ekta. Good afternoon, everyone. I'm so happy to be here presenting this session. Before I start, I should actually congratulate you guys for starting this Friday wellness sessions. I've been going through the initial presentation. It is so nice of you guys, to take care of your workers and look after their well-being. As part of it, I'm very glad and extremely happy to be presenting a seminar on oral health. I hope it will be of some use to you and it will create a lot of awareness, not just to you, and you can also take this experience back home and then spread with your family and friends. Right. So good afternoon once again, everyone. Um, Today's topic is about oral health and how to maintain your dental hygiene. Okay. So firstly, before I start, let me introduce about myself. I'm Dr. Sai Praneeth K. I'm a zonal clinical head at Globe Dental. I work at Hyderabad. I have a total of 14 plus years of clinical expertise, and I've completed both my graduation and post graduation from Chennai. Okay. Before I start with the webinar, I would like to introduce my company to you, my organization. Most of you must be aware of the brand called Clove, but for those who are not totally aware of it, I would like to give a brief run through so that you're aware of the standards and qualities that we maintain at our organization. So we are the largest healthcare provider in the nation. So we have 450 plus clinics and counting. Our aim is to cross about 1,000 clinics in the coming few years. So these are the number of treatments we do on a daily basis. We have totally completed about 5.4 lakhs of dental fillings, 2.7 lakhs of extractions of spoiled teeth, and we have a total of about 1,200 plus team of dentists. And we are the organization with the largest number of root canals that are done in the entire country. Close to ranging up to 2.5 lakhs, and we have also placed more number of implants than anybody else. That ranges up to about 60,000 implants. Yeah. And also, apart from the wide range of treatments we offer, we also follow very strict sterilization protocol, which is why we stand apart compared to all other dental service providers. Nowhere, I can bet you nowhere else in the country or in the world, as a matter of fact, you would find this 100% sterilization protocol that we follow. We follow a 10-step sterilization protocol to ensure that all our instruments are completely safe and sterile before they go into your mouth to perform any other treatments. So these are the very briefly, these are the steps we follow during sterilization protocol and cleaning of our instruments. There are 4 steps involved. First is dipping in disinfectant solution. The second is cleansing in ultrasonic cleaning chamber, ensuring that all the microbes are eradicated, and then we dry them and pack them in sealed pouches, and then we use a B-class autoclave, which is a world-class autoclave, which has 100% sterilization efficacy. And then after sterilizing the pouches and instruments, we store them in ultraviolet C-type ultraviolet light, which again eradicates any if there is any surface microbes that are present. These ultraviolet C lights are very more capable of eradicating anything that is left out beyond that. Apart from this, we have also invested in aerosol suction and decontamination units and constant fumigation devices. So these aerosol suction and decontamination units have been procured by our organization during the time of COVID, because aerosol contamination was the very big thing to spread the virus. So we have invested heavily in these machinery, and we are still continuing with the protocol, post-COVID protocol, ensuring that there is no chance of any other viral infections that can spread through aerosols. Apart from that, we also use this constant fumigation devices that we use to fumigate or clean the entire operatories and the waiting areas once the patients leave the environment. And then we also have this bi-monthly quality cycle. We have a dedicated quality team who perform in person and on video call quality protocols, so that we are forced to uphold the quality. In that way, we are always delivering 100% of quality treatments to our clients. So what is the purpose of this presentation? So the purpose of this presentation is to create motivation for regular and timely dental health checkups. I'm sure some of you must be visiting your dentist once in at least once in at least 6 months, or once in at least a year. Of late, I see the awareness for dental health has slightly picked up when compared to the previous years, thanks to the presence of social media, and then some influencers on the social media who are trying to help the general public. If you have not been doing so, I would urge all of you to visit your dentist at least once in 4 to 6 months, to ensure that you don't you get any treatment done in the initial stages before it flares up into a bigger disease. And also, we are here to this the purpose of this webinar is also to raise awareness of oral health in the context of general health. Briefly, I will also be talking about how your general health and oral health are connected to each other, and how there is a bridge that can possibly cause serious health issues if your dental health is not taken care of in time. And also a brief overview of oral health issues. So next is, what do we mean by oral health? Like how we have general health, we also have oral health. Oral means nothing but it is your mouth, and the health of the oral cavities is nothing but oral health. So oral health includes everything related to your mouth. That is your jaws, your chewing muscles, your roof of the mouth, your inner side of the mouth and throat, which also includes tongue, lips, salivary glands that produces saliva, your mouth and face pain, and also your oral or throat cancer. All these come as part of oral health. So oral health is essential to the quality of life. Lot of us always think that oral health is not very important. It is all the general health that we should be really worried about. No, I would contradict such statements. Your oral health is as much important as your general health. As a matter of fact, they say your mouth is the gateway of your body. So any symptoms of your general health are first reflected in the oral cavity. I'll give you a very brief example, very short example. Suppose you have a chronic digestion issue or constipation. The first and foremost sign you find in your body is in the oral cavity. You find it in the form of small ulcers that are extremely painful. This is a very basic reflection of your inner health. So many more diseases, many more systemic diseases, or your general body health, general body diseases express a lot of oral signs and symptoms in the oral cavity before they actually take place in the general body. So oral health, if not taken care of properly, it always affects your biting capacity, your chewing ability, your smiling. So when your oral health is not good and your gums are bleeding, your teeth are crooked, you are never confident enough in smiling. And especially if you have to speak on larger podiums or public podiums, you will not be able to confidently do so, because the thing always keeps running at the back of your mind that your oral cavity is not at the best of its health. And also, it might also affect your psychosocial well-being when you're not able to interact well with the public, when you're not able to smile and laugh confidently. It has a psychological effect on your well-being. So one of the most common factors of oral health, not maintaining oral health, is the oral pain, which is of most of us would have experienced it at some point of time. And this oral pain is the most devastating pain that you could ever experience in your general body. So what happens when there is a lot of oral pain? It can have effect on our daily day-to-day functions, like poor school performance in children. Children might not be always be able to tell the parents or the caretakers that they have dental pain, because they don't know how to express it. When that is happening and they are not able to express it, and when they are trying to suppress the pain or live with the pain, the overall performance of the children is always affected. Also, like how it affects children, it also affects adults, because it'll the severe oral pain that, or the mild or radiating or dull pain that happen occur in your mouth, will always take your diversion, take your concentration away from the work. As a matter of fact, because of which your productivity also decreases. Okay. And because of this constant difficulty or chewing pain, or or a discomfort, you always have this difficulty in chewing, and as a matter of fact, because of which you will have poor nutrition. Your body will not be able to take up all the nutrients, because you're not able to chew food properly, and the food is not properly digested. The nutrients are not absorbed into your body, and you'll slowly start showing up other forms of general diseases. And also, when the oral health is not attended to in time, it can be a very costly affair. Unlike the general health, your oral health is very, very costly affair if it is not attended to on time. And apart from this oral pain, you also have other most common these things are dental decay. It's also called as, in normal layman terms, it can also be called as caries, cavities, the black color black color color you see on your white part of the tooth. And also, if it is not attended to on time, again this cavities or gum diseases can lead to tooth loss if it is not attended to in time. And what happens when there is dental decay and tooth loss or tooth pain when the shaking tooth? It again, has a lot of effect on your psychology. First thing is, it can affect the way you smile and talk, because it affects the aesthetics, obviously. It can also have a lot of self-image issues. It can cause a lot of self-image issues. You would not be able to speak fluently. Your language might have problems because you would not be able to open your mouth. You might feel embarrassed when you're talking to people. And also, once you're aware of a problem and it is not rectified in time, like I told you, dental treatment can be very, very expensive, because the bigger the problem is, the more amount of the time we have to invest, the more amount of the material we have to invest, more amount of equipment comes into picture, and it becomes all the very costly affair. So how common are oral diseases to us? So most common oral disease, like I told you, is dental caries, which is again the black color discoloration that you find on the white part of the tooth. It is 4 to 5 times more common than asthma. Most of us are not aware of this, but dental caries is the most common diseases that can occur in the general body. It is just that most of us don't have pain in the initial stages. We don't usually go to the dentist for a checkup, or we don't usually look at in the mirror. We are not aware of, we're not even aware that it exists until it gives us a pain. Once it starts giving us the pain, it becomes very difficult for us to control it, and then we'll have to go to the dentist. The dentist performs various procedures to for pain relief. If you The recent study has shown that in schools, 25 to 30% of the children have untreated decay. This comes down because as parents or caretakers, we usually don't look into children's mouth, and we usually don't monitor how they brush their teeth. We just give them a brush and gel, like flavored toothpaste, and we just enjoy the cute things the children do. But we seldom look into the children's mouth, because of which 25 to 30% of the children have this tooth decay. Maybe because of the types of foods they eat, the sweet foods before going to bed, having sweetened milk and all this, they can have lot of sugars in it, and because of the sugars, the bacteria will get activated. And once the bacteria sits on the tooth, it releases a lot of acids that can eat the tooth away, and it causes the black color cavities. And apart from this cavities, there is also a next big thing called gum disease, which affects 47% of the adults in the recent survey that has been taken. Apart from the gum disease, there are like almost 50,000 oral cancers that are diagnosed annually. This comes down largely to the type of habits most of the younger individuals are adopting these days: smoking, consuming alcohol, different types of non-smoking tobacco products, and also the foods that we eat are mostly carcinogenic these days, because of which oral cancers have also become the next big oral disease, next to cavities and gum diseases. What happens in oral cancer? Almost unknowingly, 10,000 deaths per year are occurring due to oral cancer. If it is pertaining to cities, because of the lack of availability of lot of diagnostic equipments and healthcare services, we know what is happening. But when you go to the rural areas, lot many of them don't even know that they're suffering from oral cancers, and by the time they realize that something is actually there, it is too late for them to rectify it. And like I said, the mouth is the gateway of the body, and taking care of the mouth helps keep the rest of the body very healthy. Okay, this is the connection that that is usually there between oral health and general health. This is not what many of us usually know, because it is not taught to us anywhere in the schools, nor any medical professional also. When you go for a general treatment, they would not usually recommend you to go to a dentist unless you complain of some pain nearby tooth or ear or nose. But the thing that we all have to be aware of, at least now, is that your oral cavity and its health can largely impact your general health. Scientific research has established a link between your mouth infections and serious medical problems. So I've mentioned some of the medical issues that can arise because of your poor dental health. The first and foremost and very big thing is the heart disease. It's called coronary heart disease, because your mouth has a lot of blood supply, and the entire blood supply to the body comes from the heart, and your heart is connected to the entire all parts of your body through blood vessels. So when there is very poor oral health that is maintained in the body, there is a lot of negative bacteria or bad bacteria that is surviving. These bad bacteria can enter the blood vessels through your gums or bleeding spots. From there is every chance that they can enter your heart, and then they can cause very severe heart disease. Apart from this, like I said, mouth cancer is also related to your general health, and it can also be related to your poor oral health. And diabetes is one of the biggest things that is, you know, it is the biggest demon-like thing that is actually affecting the current population. Even it is not even sparing young children now. Diabetes, please know this: diabetes does not necessarily come during old age. It can also occur in younger individuals. And part of the day, patients who are suffering from diabetes, if you go to a dentist, have a checkup, most of them will end up having, gum disease, because of gum disease, diabetes can also occur. Because of diabetes, gum disease also can also occur. So diabetes and gum disease are like, twin sisters or twin brothers. One exists, the other automatically coexists. And then, again, when you have bad oral health, you have gum disease, because of which you have loose teeth, then you have tooth loss. And then, like I said, it also affects your speech, your chewing capacity, your digestive capacity, your psychosocial well-being, everything. It generally has a very bad impact on your overall health. And also, apart from these diseases, your poor oral health can also cause severe lung conditions, and also cerebral strokes, brain strokes. So six oral problems you can face if you have diabetes or excessive tooth decay. Because in diabetics, if you know, diabetic individuals usually have very poor salivary flow. They have very dry mouth. Your saliva is natural cleansing activity that happens in your mouth. So whenever you eat something, and if it is not cleansed on time, your saliva, the natural flow of the saliva, will wash away everything that is sat on your tooth. It will also keep completely washing the bacteria that is sat. And also, apart from that, your saliva also has a lot of immunoglobulins, antibodies. It has the ability to fight off a lot of bad bacteria. But in case of diabetics, what happens is your salivary flow decreases, because your metabolism is entirely altered. Because of a decrease of salivary flow, there is excessive tooth decay, because there is no more natural cleansing activity there. There is excessive tooth decay. You can find more number of cavities, tooth decay in people with diabetes. And also, because of again, lack of natural cleansing activity, more presence of more negative bacteria, bad bacteria, you have a lot of gum diseases. Then some of them also have taste impairment. Some of them lose the senses of taste because of presence of diabetes. Some of them have salivary gland dysfunction, like I said, because of which again there is lack of salivary flow. And there is delayed healing also. Okay, delayed healing means whenever you have some wounds, or some problems in your body, and it is supposed to heal. Because of diabetes, your immunity is always very on the lower side, your metabolism on the lower side, your body is very slow in response to healing. And also, you tend to have this thing for fungal infections, multiple bacterial infections, viral infections, because your natural immunity is always low. So this is a diagram depicting how a dental disease can actually affect your heart. You can see the red color portion around the tooth is the infected gums, where there is a space between the tooth and the gums, from where the bacteria enter into the bloodstream, and the bloodstream is connected to your heart. So all the bacteria along with your blood flow will go to the heart, and it can cause very severe heart diseases. So periodontitis means nothing but gum disease. The kind of complications it can have is, like I already told you, it can cause you brain stroke, it can cause you heart disease, and it also can cause you diabetes, because of the poor immunity and the bacteria that it circulates in the blood. Another thing that is not well spoken of these days is, most of us working individuals, be it any profession, most of us are under some kind of stress. Right? It might be personal stress, work stress, or any kind of stress. And we should also know this stress is a very big thing. Stress is the next big thing that can cause you gum diseases. Okay, how it can cause gum diseases is stress releases a hormone called cortisol, which has a very damaging effect on the body, not just on the tooth and the gums. It can have a damaging effect on your overall health. It can cause you early aging, early hair loss, pattern baldness. Your skin starts wrinkling. You start looking more and more older because cortisol is this hormone that actually releases stress, and then it can have a negative effects on your body. Apart from the body, it can, like I told you, it can damage your gums, it can damage your teeth, and also your general health. And people with stress often, if you notice, they always have this clenching disorder. Not knowingly or unknowingly, when they are working or when they're sleeping, they try to clench their jaws together so tightly. What happens is your teeth will start wearing away. All the protective coating, which is called as enamel, the white color coating that is there on your tooth surface, because of excessive clenching and then grinding of teeth, it wears away at a point of time. And then what happens? There are inner layers of teeth that get exposed outside, which will make your teeth become very sensitive to hot or cold foods, or drinking hot or cold foods, or exposure to hot or cold climates. And this can again negatively impact your quality of life. And once your teeth starts getting ground away, and the size of the teeth starts getting diminished in this size, you have something called a joint called temporomandibular joint, which connects your upper skull to your lower jaw. So what happens when your teeth, the overall length of your teeth are shortened, the joint is compressed. So when the joint is compressed, there is a cartilage, like how we have a cartilage between your knee joints, which facilitates the easy and free movement without any hindrance. Once the cartilage is damaged, the bones start rubbing against each other. So when there is constant rubbing against each other, there is a lot of friction, because of which there is a lot of heat generated. Because of heat, again, your joint undergoes degeneration. At a point of time, what happens when this is not rectified or corrected on time? Your joint starts becoming immobile. So your normal mouth opening, which is supposed to be 3 finger width when you open your mouth, it slowly starts becoming 2 finger and 1.5 fingers mouth width. So what happens when you cannot open the mouth well or properly? The ability to take food inside also decreases, and the ability to chew the food also decreases, which will again, like I told you, affect the quality of life. So this is the temporomandibular joint I'm talking about. This is the lower jaw, which is called mandible, which will house all your lower set of teeth. And this is the upper jaw called maxilla, which will house all your upper set of teeth. The upper jaw is always fixed to the skull. So this is more of a immobile bone. Whereas your lower jaw has a ball and socket, kind of like exactly like how it is your knee and socket joint. So whenever you're opening mouth, your jaw goes forward and backward like this. So once your teeth are affected, when there is lack of teeth or the overall size of the teeth is affected, the joint gets compressed into the ball. So once it gets compressed into the ball, the free movement of the hinge does not happen here. It gets obstructed in this joint. So because of which you will have very limited mouth opening. And every time you're trying to forcefully open your mouth, it either gets stuck, or you have a lot of tenderness or pain in the socket. So apart from this, we should also be talking about dental health, especially abled children or adults. So dental health and mental health are also very closely related to each other. So in specially abled individuals who lack this manual dexterity, because they don't have this motor coordination, they cannot brush like how a normal individual does. So because of lack of proper brushing technique, or proper aids, what happens is most of the specially abled individuals, when you notice, they'll have a lot of gum diseases, because of which again they'll have a lot of cavities, loose teeth, and again loss of teeth, which can again have a negative impact on their overall health, and their survival rate itself becomes very less, because there is no proper nutrition that enters their body, because they don't have proper set of teeth. So if you encounter any such family, friends, or relatives, or references, when you find this uh, mentally especially able, kindly advise or suggest them to visit a dentist once in every 3 to 4 months, because as such by themselves they are not capable of maintaining their dental health. So they would require the help of a professional in maintaining their general and oral health. So in such cases, what the dentist does, the dentist does a general examination and do a thorough cleaning, and then advises power toothbrushes. So power toothbrushes are, electric toothbrushes. I'm sure most of you should be aware of it by now. There are a lot of advertisements that are going on. The manual toothbrush will require a lot of dexterity for us to, have a specific set of motions, either back and forth motion, top and bottom motion, down and up motion. But in case of power toothbrushes, since it is electric, the motions are already preset. All the individual has to do is just at the press of a button, you just put it on certain set of teeth. The brush itself will perform all the set of actions, and then can you slowly start moving on to the next 3D, in such a way that you cover the entire mouth. And as a matter of fact, these power toothbrushes are not only recommended for especially able. Even a normal individual can also use this power toothbrushes, because there are certain areas in the mouth where your regular toothbrush will not reach, because the regular toothbrush head is slightly larger in size, and the especially in the back corner areas of the mouth, your brush will not be able to reach. In such areas, your power toothbrushes will come into rescue, because your power toothbrush has a minimal head with minimal number of bristles. So with less discomfort, your toothbrush can reach those areas and will aid you in effective cleaning process. And in these specially abled individuals, when because their oral health is not properly maintained, and because they're not able to chew food properly, they're swallowing food in most of the times, and because of swallowing of food, again there is a metabolic disorder which will again result in diabetes. Again, diabetes will again cause gum disease. So it is like a vicious cycle which will keep pulling you inside, and you'll end up losing all the teeth finally one day, and you'll have to go for artificial set of teeth. And this is one of the topics that I'm very much interested in, because this topic is not much addressed these days, or not many are aware of this effect of no oral health in women and how their hormones function. So basically, women has three stages in life. One is puberty, pregnancy, and post-menopause. Puberty stage is where there is increased blood flow to the gums. Okay, because of which many, although they might not report or they might not be aware of, if you can recent study has shown that if you can actually go and talk to this women at the time of puberty, most of them will have this swelling or bleeding gums while brushing. That is because there is increased blood flow because of this puberty. And also in pregnancy there is a condition called gingivitis. Gingiva is nothing but your gums. And this pregnant women, again, they'll most of them will have swollen gums, bleeding gums, loose teeth, sometimes pus coming out of it. That's why these days, if you go to gynecologists are recommending pregnant women to meet a dentist before second or third month, so that they can get all their dental issues addressed. Because during the course of pregnancy, you cannot get your treatment in at whenever we want, because there are a lot of restrictions. It can affect the baby inside the womb. So even the dentist is very skeptical to carry out all the procedures during pregnancy. So my advice, if there are any pregnant women, or anyway someone who's willing to become pregnant, you should always visit a dentist before you actually plan pregnancy, so that this does not affect your baby inside. And also, there are studies that when there are gum diseases that are not treated during pregnancy, during the course of the pregnancy, it can cause either preterm low birth weight of the babies, that means immature baby delivery, or sometimes stillbirth. Stillbirth in the sense, some babies come out. They don't come out alive because of the bacteria that are present. They can be very deadly to the baby inside the womb. And also post menopause is where majority of the women suffer these days. It is a stigma. Most of them don't speak about it, but during our studies, during our experience of dental practice, what we have observed is most of the women closer to menopause or during menopause, they have a lot of dry mouth because of the hormonal balances. Again, your salivary glands go into improper function. There is no proper salivary flow, because of which there is no lubrication of the oral cavity. When there is no lubrication of the oral cavity, it becomes so dry that your entire tongue, lips, and inside mucosa starts cracking up, like how your feet start cracking up when there is excessive heat. Because of this cracks, what happens is they experience a lot of burning sensation of the mouth. They become very sensitive to having slightly sour foods, spicy foods. They tend to avoid all these things. Either they eat more amount of ice creams, cold foods, or bland foods. Again, because of which, again, it will have a lot of psychosocial impact on their well-being. Okay, and because of the dry mouth, like I told you, there is no salivary flow. Again, they are more prone to having tooth decays and gum diseases. And this is one other thing, again, when your gum disease is not treated on time, it can also have an effect on your oral health, especially for women. There are certain studies that have linked that if you're not able to maintain your oral health properly, it can also cause breast cancer. Although the rate of occurrence is not as much as other diseases, but there are certain instances where your gum diseases have resulted in breast cancer in certain individuals. And also, this is a burning topic that what happens is, we as an individuals, as caretakers or parents or children, what happens is we don't give enough attention for dental health, either during the early stages of life when we are a children, or or to our parents or whom we have to take care of, we don't give proper attention to their oral health during their old age. See, what we should understand is we should have proper fixed firm set of teeth only while when we are old. When you're young, your body is very young, your body can cope anything that you eat, body can withstand anything that you give it. But when you're old, it is when you need all the good set of proper set of teeth for properly chewing the food and to properly digest the food and get good nutrition. Most of us, what we do is either we don't have the awareness to to ask our elders whether if they're feeling fine with their oral cavity, should they visit a dentist. Either we don't do this or we are not aware of it or they don't tell us, which is why I urge all of you, if you have any elders in your family, kindly as a part of routine dental care like how we do, we should also take them to the dentist once in a while, get their routine dental checkup done. If they have any missing teeth, please take it as a priority to give them missing teeth so that they can chew properly, which will again in turn have a very positive impact on their general health. You might believe me or not, not having proper set of teeth can actually reduce the life expectancy of elder individuals. When an elderly person has a lot of good set of teeth, even their life expectancy, the number of years they live will also increase because they have proper nutrition coming to their body. So what happens? Most common problems during old age that occur are receding gums, where your gums start slowly coming down, exposing your teeth, which will again make your teeth become very sensitive to hot or cold foods. Sometimes the teeth might start shaking. There might be decay in the roots, okay? And they'll not be able to maintain enough oral hygiene. There'll be a lot of wear and tear of the tooth, where your teeth tends to become very flat because of excessive use. They'll have sensitivity to hot and cold foods again. There is gum disease, dry mouth, and in rare instances, there can also be oral cancer when they are not treated on time. So, other than this, we should also be talking about the habits that most of us are adapting these days. You know, consuming alcohol or smokeless tobacco or tobacco products is also becoming kind of fashion these days, and sadly, unfortunately, in college-going children and teenage children. So, what happens is when you consume all these things in excess, you will end up having gum disease, loss of teeth, like you all know, oral cancer, and negative effects on general health. Not just these habits, and also we should also know that excessive brushing. Lot many of us have this misconception thinking that if you brush for more than 10-15 minutes, your teeth will become very clean. No, that is a very wrong notion. I would not recommend brushing your teeth more than 2 minutes at a time. You should brush 2 times a day, 2 minutes at a time. Beyond this, what happens is because of the friction that you are causing on your teeth with the bristles, all the enamel on your teeth, the white color portion that is there on the tooth will get worn away. Because of which, again, your inner layers of the tooth will get exposed outside, and again, you'll start having gum diseases, cavities, and sensitivity while eating and drinking. Okay, this is a classic picture of excessive brushing, where this person has brushed more than 10-15 minutes per day. What you can see is this is a white portion that actually covers your tooth like a raincoat. What happened here is because of excessive brushing, the entire enamel is gone, and it is like you have taken a knife and then chopped off the entire tooth. And all these spaces are also not healthy. This again indicates the underlying gum disease because of excessive brushing also. And this is the correct amount of toothpaste you should be using. If the child is less than 2 years, you should have just a minimal drop of a toothpaste on the brush. And if the child is 2 to 5 years, should not exceed more than a small pearl. And if the child is more than 5 years, and even for adults, the amount of toothpaste that you should use, it should not be more than a peanut, a groundnut size. That is more than enough. What happens is when there is excess toothpaste on the brush, and if you're brushing for a long time, there is a lot of foam inside the mouth. You barely see anything in the mouth. You will not be able to concentrate where to brush and how to brush because of the excess foam. When you have the right amount of toothpaste, like the size of a peanut, the foam is also of the right quantity. So you will be able to visualize everything that is there in the oral cavity, and then you can notice where to brush, how to brush, and why to brush, and that way you can maintain your oral cavity optimal. Okay, so not many of us know this. This is one of our favorite tools once we go to restaurants or to any places to functions or something. Immediately after eating, we take this sharp colored thing, sharp object thing, and then we start picking between the teeth. So what happens when you start picking between your teeth with this toothpicks? You might not know it. Once you insert a hard substance like a wood between your teeth, you're creating a permanent gap between your teeth. This is an example of a person who has been using a toothpick for a very long time. So you can see this is a very typical defect because of back and forth motion of a toothpick. Once you start doing this back and forth motion, you're actually creating a tunnel-like gap between your teeth. So what happens every time you eat, more and more food will go and get stuck there, and you are forced to use more and more number of times the toothpicks. So more and more number of times you use toothpicks, you're actually creating more and more bigger and bigger gaps. More food will keep going inside. So this is a vicious cycle. There is no end to it. Once you start using it, there is no end to it. It goes on and on and on to a point where majority of the tooth structure is lost, and ultimately it will fracture. It will break down one day. Okay. Next is moving to the most common types of dental disease. I have also briefly explained before. Now I will slightly run through a bit more, in detail so that you'll be able to understand what to do, when to do, and how it is. So the first and foremost thing is the cavities or the caries that I spoke about. This is the normal structure of a tooth. Okay. The white color portion that you see in the oral cavity is this, and the rest of it will be under the gums, under the bone. So the white color portion that you see is called crown, and the root, the portion that is present under the bones is called roots. Okay. In the crown, under the crown, there are three layers. One is enamel, is the topmost layer, followed by dentin, which is spongy in nature. Just like how we have a sponge, it has a lot of water that is present in it. Below which we have something called pulp cavity, like how we have flesh inside the body, like a muscle inside the body. Your tooth will also require some flesh through which the blood and nutrients will come and keep the tooth alive. This is the normal structure of a tooth. Okay. So how are dental caries? How do you get dental caries? So dental caries is a combination of the kind of food you eat, and how good your teeth are maintained, and how good your teeth are placed well, and also the type of bacteria that is present in the mouth. So dental caries is the most common chronic disease of childhood that is present in across entire globe. Okay? It is the most unmet health need. Even when the children complain of dental pain, the tooth pain, we see a lot of clients on a day-to-day basis. The parents come and say, "Doctor, my child is having tooth pain. What should we do?" So we suggest them, to save the tooth, we have to do a something like a root canal procedure for a tooth. The parent immediately responds. A majority of them respond saying that, "No, why should we spend so much on a tooth that is going to fall?" Do all of us know that during the process of our life we have two sets of teeth? One is milk teeth, one is permanent tooth. The milk teeth are not given just for the sake of it by God. It is given so that until our permanent tooth are erupted into the oral cavity, the milk teeth will perform their function. What happens if there is bacteria, there is cavities, and the child is suffering from pain, and we remove the tooth from the oral cavity before the permanent tooth is erupted? There is an empty space where the child will not be able to eat at all. Because what happens, because of which he or she starts chewing food on one side. Like I told you, there is a joint, there's a combined joint. What happens when you start chewing food only on one side? This side of the joint is excessively compressed, this side of the joint is excessively pulled out. As a result of which, because of our negligence, because of our, you know uh, uh, because of us not being aware of the side effects of it, we are actually forcing the child to have a very poor quality of life when he grows up. Because of, like I told you, because of the joint issue, they will not never be able to chew properly. And if at all the child has any metabolic disorders in the future, since not able to chew properly or open the mouth, or grind properly, if the child happens to have diabetes, please do not blame it on genetics. It is also because of the lack of awareness we have created in the child, or we ourselves have as a parent or a caretaker. So I urge all of you, if you have children, please take your children to a dentist once in every 3 to 4 months. Get a thorough oral prophylaxis done and thorough checkup done. If there are any filling small black cavities that are present in the initial stages, they are very easy to be restored. They can be very easily filled, and the child will have a normal and very confident life. So what happens if the child is growing up and he does not have some set of teeth? It will have a lot of impact on his psychological effect. The child will not be able to confidently go out and smile in the public. The child might not be able to confidently go out and speak in public. We might not be aware because what the child might be going through, the mental trauma is more too much for the child to handle. So these are the stages of caries development for your information. Like I told you, this is the normal structure of the tooth. This is the black part that is called cavity. And when the cavity is limited to this white color portion called enamel, the treatment that is related to only what we do is a small filling will suffice. Once the cavity is not addressed to, when it is confined to the enamel, when it starts going inside and affects the pulp or the flesh inside the tooth, this is when the more expensive treatments come into picture. So the only treatment option that is left after the cavity enters the pulp is a root canal treatment, which is again very expensive. It just does not end with it. A root canal treatment should be followed by an artificial crown. So what happens when you have nerves, proper intact nerves in your mouth? You can actually feel your teeth if you touch with your tongue. But when you have a crown and artificial teeth, when you touch with your tongue, you will never be able to feel it because it is not connected to your body. It is something artificial that is being manufactured outside, and there are no nerve connections. Now that you since your tooth is dead without any nerves, no matter how much you try to feel with your tongue, you will never be able to feel it. It will always feel like a foreign body in your mouth, like an alien in your mouth. So my urge is whenever you find a small cavity confined, please go to the dentist and get it filled before it actually flares up and becomes a bigger issue where you end up having more discomfort, spending more, and then having this unnatural and artificial feeling in your mouth. And there are some individuals we have noticed who do not get the treatment done even when it is required, when a root canal treatment is required. In such cases, the infection spreads further down. It affects the entire bone outside. And like we should all be knowing that all the teeth are placed in line with each other. So once when the infection spreads into the bone and the infection spreads to the sideways, it also starts affecting the health of the adjacent tooth. So when we compromise on the health of one tooth, we end up compromising the health of two adjacent teeth on either sides. So this is the stage of caries progression. Initial stage is how it is like a small dot. When it is not addressed to, it goes slightly deeper into the next layer, and then it further deepens into the next layer, and then it affects the pulp inside, which is when either we have to do a root canal treatment, and if the infection is too large and we are not able to save anything, we'll have to ultimately extract the tooth. Extract means remove the tooth, spoiled tooth. And once you remove the spoiled tooth, what you have to do is you have to go for replacements, which again is very expensive, very laborious, very time taking, and very discomforting. Okay. So what are the factors that can affect tooth decay? So risk factors that are shared by adults and children include one thing, like I told, main thing is bacteria, the type of bacteria that you have in mouth. Again, this comes down to your maintenance of your oral cavity, how many times you're brushing, how long you're brushing, what kind of food you're eating. If you have a family history or a familial history or a hereditary of cavities, again, you will be more prone to cavities. If any of your parents have any gum disease, cavities, or crooked teeth, it is more likely that we and our children will end up having the similar kind of thing. So whenever your parents have a dental issue, it is an alarm bell that your genes is giving you. Okay, when you look at your parents having dental issues, it is it is indirectly reminding you, boss, please go to a dentist and get a checkup done before you end up losing all your teeth in the mouth. So that is kind of an alarm bell where you have to actually realize that yeah, this is time for me to go to my dentist, get a thorough checkup done, and protect my teeth for a longer time. And then in certain places where there is inadequate fluoride in the water, again your the entire structure of your tooth becomes so weak that it will become very susceptible to cavities. And again, when there is low saliva or dry mouth, for various reasons, if you have smoking habit, you have less salivary flow, and then your mouth becomes dry. If you have diabetes, you again have less salivary flow. And one of the most important dangerous thing that exists in our country is over the counter medication. So whenever we have a problem, be it tooth pain or headache or any kind of pain, we straight away go to the medical shop. We don't go to the doctor. We don't trust a doctor as much as we trust the receptionist or the medicine dispenser in a medical shop. So what happens with this over-the-counter prescription drugs? See, there is something called an antibiotic resistance. Whenever you have an infection, you go to the medical shop with some kind of pain and ask him. He gives you an antibiotic dosage. And from what I have noticed, is the majority of the medical shops, they give you 1 day dosage. So what happens when you take the antibiotic for a single day, your antibodies are produced, and then your antibodies are not sustained to beat the bacteria for a longer time. So your bacteria kind of develops a sensitivity or resistance towards this antibiotics. So for example, if I'm taking a 500 milligrams of antibiotic amoxicillin for a mild gum infection for a single day, and I'm not continuing it for the next 3 4 days, the next time when I have an infection, the 500 mg of antibiotic will not work for me. I will have to go for a bigger dosage, 650 milligrams or 1000 milligrams or 1250 milligrams. Which will what happen is there are a lot of side effects for the medications we take. One of the most common side effects of prolonged over-the-counter medication is the dryness of mouth. Again, which like I told you, dryness of mouth will cause a lot of gum diseases, cavities, loss of teeth. It will overall affect the quality of your life. And also low socioeconomic status. Fortunately, all of us are well placed, so we have the capacity to either go to a doctor or go to a medical shop and buy a oral cleansing aid, buy a toothbrush or a toothpaste and mouthwash, and then maintain it. For people with lower socioeconomic status, most of them end up having this very poor oral hygiene because of which their life expectancy also decreases. Like I told you, the bacterial load is so much that it enters the blood and then it ultimately affects their target organs, be it heart, the kidneys, the lungs, the brain, or something. So if you find somebody, uh, if you find somebody who's coming from a low socioeconomic status, like somebody that is working under you in the office, or your mates or somebody in the house, you can always give them an advice to go to a dentist, or you yourself can actually volunteer to take them to dentist, get a checkup then, and trust me, they'll help, they'll thank you for an entire lifetime, because you're actually giving them a quality of life without even giving them direct payment. Once you can identify something and take them to a doctor and get a treatment done, or at least advise them to get a treatment done, they'll be thanking for an entire life, because they'll have their own intact set of teeth for with which they can chew on for a very longer period of times. And also, apart from all this, aging, old age again will cause you, as a part of aging process, like how we get wrinkles, we lose our hair, we get eyesight. There is also something called aging gum disease, where your gums slowly start becoming weak, your teeth will start shaking, and your loss of teeth can happen. So this is a picture that is depicting gum disease. So there are three stages of gum disease. One is marginal gingivitis, where the gums are the infection is very marginally present. The second is called gingivitis, where the infection has slightly gone downwards. You can see the brown color staining here. It is actually affecting the gum inside. And the third is advanced stage, where the infection has gone further deep down inside, where the gums have got separated from your tooth. There are a lot of spacing that are present between the teeth, and then it is also affecting the height of the gums. So ideally, the ratio of the tooth to the root. So the crown to the root ratio should be 30% of the crown should only be visible in the oral cavity. The rest of the 70% should be buried inside the bone. But if you can see here, the ratio is getting slowly altered. It has become almost 50-50%. So what happens when the bone level goes down? Every time you are biting, there is no enough basement for the tooth to sustain the weight. So the tooth will start shaking either way, sideways. And once the tooth starts shaking inside the socket, it becomes highly impossible for the tooth again to become stronger. So once a tooth starts shaking, it will start shaking forever, and you will end up losing the tooth. So what should we do is, whenever you notice there are some deposits like this in your mouth, some deposits other than the pink color and white color, if you find any brown color or green color stains, that means you are already into a moderate gum disease, which is why you should run to a dentist immediately, get your teeth checked. Okay. So diabetes again, it increases the risk for many infections, including gum diseases and other illnesses. Like can also negatively affect your gum disease, like diseases such as AIDS, some viral infections. When you have chronic digestion issues, it can cause a lot of ulcers in the oral cavity, because of which you will not be able to brush your teeth again. Because of again, when you're not able to brush it, it can again lead to gum diseases. And because of the habits that we have, it can also give us cancer. For cancer, the treatment is also not extensively available these days. Only the initial stages of cancer can be treated. The moderate and final stages of cancers cannot be treated, no matter how much we spend and try to rejuvenate our health. This is a picture showing how our initial gum disease, marginal gum disease, looks like. When you're brushing or when you find bleeding while brushing or spontaneous bleeding, just like that when you are trying to suck something, that is an alarming bell that you need to go to visit a dentist. You can see in the upper teeth, the gums are very healthy. They're very pink and very leathery in nature. But when you come down to the lower teeth here, you can see they're very bulky. They look like ballooned, and because of which there are a lot of deposits. All this thing is called deposits, which has a lot of bacteria in it. Because of the bacteria, gums get irritated, and you can see the comparison here between the healthy gums and a diseased gum. A healthy gum is very firmly attached to your tooth, whereas your diseased gum is going away from the tooth, and it's also eating away the bone inside, because of which the tooth is leaving the losing the bone support, and ultimately it start becoming loose. So what are the treatments for bleeding gums? So bleeding gums will have three different types of treatment based on the severity of the disease. If it is an initial marginal inflammation, a normal procedure, very simple normal procedure is called scaling will do, which can be done on the chair side by the dentist. Almost less than it hardly takes about 30 to 40 minutes. When the disease becomes more progressive, when a disease becomes more deepening, this is where you require other treatment modalities coming into picture, which is one of the most advanced gum treatment that is available these days. Is called laser treatment. Laser is a very widely used dental equipment these days. Again, like I said, laser is a very costly equipment. Not everybody can afford outside. But in all across all the 400 plus or 450 plus clinics we have in Globe, each of our clinics are equipped with this laser equipment. So should you have this bleeding issues or gum diseases, you can always visit us. We have this advanced gum treatment available with us. You don't have to come for multiple settings. The treatment is done on a single setting. and then within a week or two, you'll start experiencing the changes in your mouth, the healthy gums, the firm gums, the fit gums. But if the disease is not even rectified at this stage, and as an individual, we are still taking it light, and it goes further deep down, this is when more discomfort starts kicking in. This is when the surgery will come into picture. It is called gum surgery or flap surgery, which is more painful, more discomforting, more time taking, because we will have to separate the gums from your teeth, clean the entire area that is present inside, be it the bacteria or the diseased deposits, and then we modified the bone underneath, because the bone here is eaten away. It has become so irregular. We make it flat and then we put the gums back and suture. But what happens even when I do the treatment? Ideally, you can see this part of the gum is almost the tip of the tooth, where this part of the gum has almost gone down. So whatever the tooth surface that is exposed here will always become more sensitive to hot and cold foods or sore foods that you eat. So the discomfort will keep persisting even if you get your dental treatment done for a very longer time. So other habits that can affect our dental health, like I already mentioned, oral cancer is caused. Yeah, like I told you, the habits like oral cancer and oral cancer can be caused by consuming too much of alcohol, unlimited usage of cigarettes and other forms of carcinogenic agents. All this will make us, uh, high risk group for getting oral cancer. Again, like I told you, the treatment for oral cancer is not very easy. It involves a very extensive removal of a lot of tissues from your oral cavity, and it can also affect your quality of life. Ultimately, not having a certain section of mouth, though we have artificial replacements available these days, they are very costly replacements. They are not widely available to all of us. So I think it is better to take care than to later suffer and then become a victim of this deadly disease. So how do we prevent from getting affected by these oral diseases, and how do we actually promote our oral health all by ourselves? Is adopt a lot of this preventive behaviors, like make proper dietary choices where you have to limit your sugar intake. A lot of us get used to use taking this sugary diets. When it is very hot outside, we immediately go grab a can of coke, or a canned fruit, a canned food, or canned drinks. All this will have a lot of preservatives, additives, and sugar substances in it. What happens is ultimately they will tilt the balance between your good and bad bacteria in mouth, and you will be more prone to getting affected by these cavities, gum diseases, and different types of dental diseases, like I've mentioned before. And also, if any of us have been using tobacco, you should probably stop using tobacco, because this usage of tobacco is very deadly, not just for the general health, but your dental health can be the first thing that will be affected by use of tobacco. Like I told you, when there is excessive use of nicotine or tobacco, what happens is the size of your blood vessels, the size of the tubes that is supplying blood to your gums, your oral cavity, your tongue, gets diminished in size. It becomes smaller and smaller. Thereby, what happens is the amount of blood that is supplied to these organs is shrunk in size, which again, blood will always carry oxygen for proper healing of the tissues. When there is no proper oxygen and proper blood supply to any part of the body, what happens is it undergoes degeneration. Degeneration means there is no repair anymore. It is only damage. There is continual damage. What happens? There is continual damage of your teeth, your gums, your underlying bones in individuals who are exposed to even passive smoking. Sometimes there are studies even present in the company of passive smokers. You can become a passive smoker, which can again have a minute effect on your overall general health and also dental health. And also, apart from this, you should have routine preventive visits to the dentist. Like I told you, 4 to 6 months, once in 4 to 6 months, a visit is very mandatory. Even for us at dentists, we go to other dentists, get our teeth checked once in 4 to 6 months, get our teeth cleaned. We undergo any kind of procedures that is required. So we are all human beings. We all have different types of set of teeth. We have different set of habits. So it is mandatory that we visit a dentist once in 6 months, and then get rid of problems that can be blown out of proportion with age and time. And how to maintain it, like I told you, brush 2 to 3 times a day, and you should not brush beyond 2 minutes, 2 minutes at a time, because like I showed you in the picture, excessive brushing can lead to loss of a lot of tooth structure damage, and again it can damage your gums. Your teeth can become finally weak, and you can end up losing your teeth. Okay. And also, you should use a fluoridated toothpaste. Most of the toothpaste in the market these days are fluoridated. You can choose what suits you. But I would, as a dentist, I would always advise you against using gels. because these gels again will have sweetening agents, and gels are slightly sticky in nature. They are not, they don't have that much of cleansing activity like how the regular white color toothpaste have. So if you can avoid, it is always better to avoid gels. But some people are allergic to, white color toothpaste. In those patients, yeah, gels are much more preferable. And also supervise your children until they turn at least 8 years old. Because why we say 8 years old is 8 years, 8 to 10 is where they actually start developing that manual dexterity, motor skills. So at least when they develop this motor skills, you should always be watchful of what they eat, how they maintain, and how they brush their teeth. Especially many children just brush in the front side, and then spit it, and then go to the school. No, as a parent, you should be around the child when the child is brushing their teeth, observe how they're doing, and then teach them mildly, or take to a dentist and get a counseling done. So these are the different types of toothbrush. The left side is what we have, the regular manual toothbrush, and the right side is we have different types of power toothbrushes. You can see the size of the bristles or the size of the brush head in the manual toothbrush is so large, especially like I told you, in the areas where you have to put your brush backwards, it becomes very difficult because there is very narrow gap, and this such a large size of this thing will not go inside. And you can see the size of the power toothbrush is very small. They have limited number of bristles, and they have preset motions. So there are different types of motion that comes in a power toothbrush. Some of them will have rotational, some of them will have back and forth motions. So you can choose based on your mouth opening, or based on your comfort. When you hold a brush, you can choose whatever power toothbrushes are. These days, as dentists, we're also recommending most of them to use power toothbrushes, because as we age on a day-to-day basis. If you are 30 today, you become 30.1 tomorrow, and your dexterity also will decrease with time. We might not be able to notice that my reflexes have gone down slowly, but it is like we start becoming older every day. So what happens is, beyond 40 years, we are advising everybody to go for power toothbrushes, so that even if you lack that manual dexterity to reach areas where you have to brush, your brush by itself has this preset motions which can actually do the function for you effectively. Yeah, sorry. So coming back to this, these are the different types of brushes we have. The left side one is called the manual toothbrush, what most of you use on a day-to-day basis. The right side brushes are the power toothbrushes, where you can see there are power options here, and the size of the bristles is also very small when you compare to the manual toothbrushes. The manual toothbrushes are so large that when you have to insert in places backside of the oral cavity, it becomes very difficult because of the size of the bristles. But here you can see they are very small, they are easily adaptable, and they have preset motions. Just at the click of a button, your brush will do all the motions for you, and it is much more effective in areas where the normal toothbrush cannot actually fit into your oral cavity. Okay. Now, like we have already discussed, throat and oral cancer are the most common causing types of cancer these days. Mostly, it comes down to the habits that we have, but it can also occur in older individuals where they have broken set of teeth, and there are sharp pointers of the teeth, where if they're not taken care of in time, it can cause a continuous pricking either on the tongue or the cheek. And when there is a wound that is not getting any time to heal, it slowly starts changing into cancer, which is again most of us don't realize because we don't either we have the lack of awareness, or we don't ask our elders if they are suffering from any dental issues. So if you ever come across an elderly person, or as a matter of fact, anybody who has a broken tooth, a sharp spicule of a tooth, kindly advise them or take them to a dentist, get it rounded off, so that it does not keep poking into your cheek or tongue, and then it can later it will not become an oral cancer. Okay. And other habits that can actually help us in maintaining good oral hygiene is when you have lack of less saliva flow, be it for various reasons, either we are a smoker or a diabetic or any other disease or any other because of medication. If you have less salivary flow and your mouth tends to become more and more dry, it is better that we keep sipping onto water on an intermediary basis, because when we keep the mouth moist and wet, there is a lot of washing away of the bacteria and food that happens. So in such a way, the natural cleansing activity is somewhere restored back to the normal. And also, when you are raising children, always raise them in such a way that you give them healthy snack options. Try to keep them away from sugars, which is practically may not be possible, but at least we can give it a try. The frequency of intake of sugars can at least be reduced, so that the incidence of caries, cavities, gum diseases, loss of teeth can also be reduced by a large extent. And also, as adults, we can replace our behaviors. If we have smoking habit, we can quit smoking, we can limit alcohol, And also, if you are opting to go for chewing gums, many of us have this habit of chewing gums, chewing onto the chewing gum when we're working or driving or going for a walk or a jogging or playing. In such cases, it's always better we opt for sugar-free chewing gums like xylitol. No, all this these days in market, even in India, we get sugar-free chewing gum. If you can, always opt for sugar-free chewing gums. So this is one of the topics that I'm very much interested in talking about. This is not at all addressed into to the general public. See, 90 to 90% of the population, especially in Indians, we all have oral malocclusion, where your teeth are not properly placed. This is a classic example where the teeth are irregularly placed. One tooth is outside, one tooth is inside. It is more or less like a rose petal arrangement. So what happens when you have a brush, when you have such crooked teeth, when you want to brush your teeth, the bristles of the brush will contact one the bristles of the brush will contact only one part of the tooth or certain part of the teeth, and certain areas are not at all covered. Especially if you find these areas cannot be covered with the brush, flat brush. So what happens over a period of time? A lot of bacteria will start getting stuck here. Again, gum disease will start. Again, your tooth will start becoming shaky. You'll lose a tooth, and then once a tooth is lost, replacement will become very much difficult here because there is no space to replace also. Apart from this, one other most most underobserved disorder we have, the people with malocclusion have, is the temporomandibular joint disorder. Like I spoke about, there is a joint here which again goes into a lot of derangement, because you can see there are two types of malocclusion. One is where your lower jaw is placed far more inside, so you can see the profile of the child or the person is more like a concave mirror here. Convex, sorry, this is a convex mirror. So where your lower jaw is placed far more inside, your upper jaw is placed far more outside. So what happens is joint actually compresses the socket inside. This is a condition where your jaw is pulled forward, where you have a more of a concave profile here. It is the shape of a saucer, where your lower, the chin is placed far more outside when compared to your forehead. In these cases, the joint is stretched forward, so that what happens is the ball and socket are always under constant stress. They are being separated. What happens is musculature, your muscles that connects your upper and lower jaw, will always be overstressed, because of which in future, whenever you want to have something, whenever there is a need to open your mouth, while you're yawning or eating pani puris, the most common thing we find in our day-to-day practice is people coming with a dislocated jaw when they're trying to eat pani puri, because the pani puri needs a lot of mouth opening to take one big of puri inside. In such conditions, what happens is, because your muscles are already weak, your jaw is being pulled forward. When you open your mouth, your jaw gets locked and separated like this. So you will have to go to a dentist, and again, the dentist will have to do a minor procedure to setting back the jaw. The disadvantage in such conditions is, once your jaw is dislocated, the musculature becomes permanently weak, and then there is more chances of recurrent dislocation. Like how you have a shoulder dislocation, knee dislocation on a common basis, you will have a joint dislocation here on a common basis. This is the joint, your lower mobile jaw, and this is the joint. What happens is, when it is either compressed or pulled out, there is always a stress or strain in the joint, which will have a negative impact on either side. One other thing that I want to make all of you aware is that airway comparison. Airway is nothing but the amount of air that you can take when you're breathing. It also depends on the type of malocclusion that I have in oral cavity. Like I told you, once your teeth are properly aligned here, your lower jaw is placed perfectly in line with your forehead. So what happens? You can see here this part. This is called your airway tube. Your airway tube is so open. So when you're breathing in, a lot of oxygen goes in, because of which your lungs are also healthy. Imagine this is happening at a very young age when you're a child. When you're not able to take enough oxygen, your lungs also don't develop. Once your lungs don't develop to their fullest extent, you will end up having conditions like asthma, not able to breathe properly, not able to run properly, not able to do exercise properly. All these conditions can impact again your quality of life. That can happen when you don't have proper set of occlusion, when your teeth are not properly placed. You can see here the airway is completely collapsed when compared to here. The amount of air that you take in is also reduced. The quality of air is also reduced, and you can end up having not a very good quality of life in future stages of life. In especially when adults or children with not having proper set of teeth, studies also show that 10 to 15% of them tend to develop respiratory diseases during the later stages of life. This is a very cute picture. Most of us know this. We see most of our children, having putting a thumb in their mouth and then sleeping. To look, it'll be very cute, but actually there are a lot of dangers for this. So what happens when your child puts thumb into your oral cavity? He's actually pressing his thumb against his upper teeth. So when he's actually pressing his thumb against his upper teeth are coming forward. As a matter of fact, what happens is there is a lot of space that is left over between your upper and lower teeth, because of which your tongue will start keep coming outside. This is a condition called tongue thrusting. Whenever your tongue starts coming outside between upper and lower teeth, there's more and more gap created. Your upper and lower teeth will start separating from each other like this. So more and more space opens. What happens when there's more space open? Certain syllables, certain sounds like S, F, all these sounds, when the child is speaking, there is a lot of loss of air. The child will start, he might end up saying, instead of sharp, he might start saying sharp. So what happens is this will ultimately have a psycho-social impact on the child's well-being and development. The child might not feel confident because when he is mingling with his friends, some of his friends or neighbors or family members may start actually making fun of it, not realizing how much of an impact it can have on the child's psychological development. So if you see a child having a thumb sucking habit beyond 3 to 4 months, it is time for you to take the child to the dentist and get it rectified. A dentist will have various means to make the child stop doing the thumb sucking habit. Next is oral cancer. So the oral cancer, just for information, I'll just run very briefly through it. It can affect any part of your oral cavity. For example, it can affect your gums. It can affect your part of your lips. It can affect your tongue. It can affect your lower part of the tongue. It can affect your side of the tongue. It can affect the deeper part of your throat. It can affect the roof of the mouth. All these areas are very much susceptible to getting affected by oral cancer. Like again, I said, most of the oral cancers are habit oriented, habit related. Not everybody on a random basis will get oral cancer, but certain non-habit oriented oral cancers can also occur when, especially like I said, when you have a broken tooth that is very sharp, when it keeps poking on your side of the tongue or poking on your side of your lips, it can cause oral cancer in some cases, very rarely though. So what is the how do you up your oral health? You can up your oral health by constantly visiting your dentist once in every 6 months, get a routine checkup done and a routine cleaning done. But this is not happening on a regular basis. See, once you go to a dentist outside, max to max, what happens is your chief complaint is being addressed, and most of the dentists do not even tell you how to keep your oral cavity clean. They will not tell you to come for regular visits. Visit the dentist once in 4 to 6 months interval, so that dentist can do a thorough examination, find out if there is anything abnormal in your oral cavity, educate you about the problem, and then give a solution to it. But we at Cloud Dental, we have a very specific preventive care membership where wherein we want to give back something back to the society. We want to help all the individuals know the importance of their oral cavity, the maintenance of the oral cavity, and we have specifically formulated a plan. Okay, where will we enroll you in a membership called a platinum membership. Okay, where we have your details, and we call you up for a checkup from the clinic side once in every 4 to 6 months. You don't have to actually remember the date to come to us. We ourselves will reach out to you from within 4 to 6 months, and we'll call you for a checkup. Apart from this, we'll also deliver 4 oral hygiene kits every 3 months to your doorstep, which are specifically curated individually for everybody. We have a specific set of toothbrushes, specific set of mouthwashes, specific set of toothpaste, interdental cleansing aids. Instead of using a toothpick, we'll give you a medicated device where it will not harm your gums, but it will also remove the food that is gotten stuck inside. Again, these are specifically designed for everybody's individual needs. So at Cloud Dental, we also not only enroll you in such programs, but as a part of doing our bit back to the society, we are doing a lot of awareness camps, awareness dental health camps in various IT offices, schools, so various backward areas, and also we are promoting these oral health programs online thanks to the social media and internet. We are able to do it much more effectively these days because of the presence of this Instagram, Facebook videos, and all these things. And we also conduct in clinic awareness days. We reach out to all our old clients. We reach out all our camp datas. We tell them that we are conducting awareness camps about loss of teeth, gum diseases, cavities, the malocclusion, how it can impact your general health and oral health. We create a lot of awareness. These are the sample creatives of some of the social media campaigns that we do, and in-house sessions that we do with the doctors. This is an implant awareness day where we have created an awareness day for people with missing teeth. We reached out to all the old people that are aged above 50 to 60 years. We spoke to them. We invited them to our clinics. We explained to them how a loss of teeth can actually impact their general well-being, and how replacing a missing tooth can actually give them a quality of life. Many of them came back to us once in 4 to 6 months, and they thank us on a regular basis, because we do this awareness days on a regular basis. Once in every month, we conduct this awareness days, and then many of them get benefited by these awareness days. They come to us, they thank us for the good job we're doing to them. I hope all of you take a clue out of the presentation that I've done here today, and take your oral health seriously as your general health. Visit your dentist once in every 6 months, whichever corner of the universe you're in. Please do make it a point that you visit your dentist once in 6 months. Get a routine checkup done, get a routine prophylaxis done. Keep up your dental health on par with your general health. And I wish you all very good luck. And thank you for being very patient with a couple of disconnections in between. This has been a wonderful session. I hope I have been of some use to all of you. I'm open to questions. If anybody has questions, I can take questions.
Yeah. So thank you, Dr. Sai, for giving us such an insightful session and in detail explaining all the parameters regarding the oral hygiene and dental care. So we have a couple of questions under the Q&A session. So one is, I'll just help you in reading out this question. So it's like, what type of toothpaste should we use for a 4-year-old child, and will two-time brushing will help in keeping teeth healthy?
See, for a 4-year child, you have fluoridated toothpaste. There are toothpaste designed specifically for children age. So if you can, there are multiple brands these days. You have one in Colgate. Colgate is the most widely used brand in India. So if you go to a medical store, you can ask the medical store. They'll give you a toothpaste that is specially formulated for for different age groups, from 0 to 2 years, 2 to 4 years, 4 to 6 years. The age gap comes with the amount of fluoride present in the toothpaste. See, every child, specific age group should have a specific amount of fluoride only to be used in a toothpaste. A child cannot use an adult toothpaste. What happens is, when a child uses an adult toothpaste, there is more fluoride that goes into the child's general body. And this fluoride, what happens is, during the development stage of the child, this child is still in the development stage. His bones and his teeth and his calcium is still developing. Excess fluoridants can actually compete with the calcium that is helpful in the formation of bones and teeth. When the fluoride replaces the calcium, your bones and teeth become much more weaker than what they're supposed to be. So your teeth can either become very prone to cavities, or your bones can become very fragile. They can fracture easily when the child falls down. So a child should use a fluoride toothpaste that is specifically formulated, designed to his age. That is normally available in any medical shop. You can go to a medical shop and pick it up.
So there is one more question. Is like, I get too much of plaque and tartar on my teeth very fast because of my gums are receding. What should I do to ensure it back to the healthy state?
Yeah. So this plaque and tartar usually, forms for three reasons. One of the main reasons is not following a proper brushing technique. Either you're using your toothbrush for too long, maybe it be for 4 to 6 months. That is not the right time. Your toothbrush should be changed once in every 30 to 45 days, based on the type of bristles you're using. So basically, there are three types of toothbrushes available. One is hard tufted, medium tufted, and super soft tufted. If you're using medium tufted toothbrush, where the bristles are medium soft, you can use your brush for 45 days at the maximum. If you're using a hard toothbrush where the bristles are very soft, you cannot use a toothbrush for more than 30 days. If you're using a super soft where the bristles are too soft, it has a very less cleaning efficiency. Most of us don't even know these super soft toothbrushes are given only to those people who have very extremely ultra weak gums. But we go to a medical shop, we randomly pick up a toothbrush, we start brushing. So what happens is, based on the type of gums you have, you should choose a toothbrush. If you're having more tartar that is getting deposited on your gums, that means either you're not brushing properly, or you're using your toothbrush for too longer periods, or you're having lack of less saliva. It could come down to you being a diabetic or a smoker, or any kind of salivary disorders. For any of these things, it is better that you always visit your dentist once in 3 to 4 months, or 4 to 6 months. Get a dentist advice. First, identify why your tartar and plaque is coming on a regular basis. And because of the tartar and plaque, what happens is your gums will start receding. Unfortunately, once the gums recede, there is no way we can bring the gums back up. It can only be a damage control, but not a cure from there on. So that is why I advise everybody to visit one dentist once in 4 to 6 months. That is the only solution we have right now.
So another question is, does flosser are safer than toothpicks?
Definitely. Toothpicks, like I told you, like I showed you the picture, it is made of wood. Wood is very, very hard. So, like I said, the space between your teeth is very, very narrow. It is a floss. A floss is nothing but waxed coated thread. That itself sometimes with very great difficulty it does not enter between your teeth. Imagine you are trying to force a big size toothpick between your teeth. What happens? You are creating a permanent gap wherein more and more food and bacteria will keep going inside. So when you compare, yes, when you compare, a floss is always better than a toothpick. But there is also another device which is come into the market, which has gained more popularity in the market these days. Is called a water pick. It's a mechanical device which looks like a more like a toothbrush with a pump. You can fill in the device with water, and you have a button. When you press the button, it gives a jet of water, like how you do a car wash. You can actually do a tooth wash. There are certain areas where even a floss cannot enter because there are tight contacts between teeth. Again, it is not advisable that you forcibly insert a floss in between. This will again create a lot of gap. So in such cases and such scenarios, using a water pick, a water jet device is of much more. It makes more sense using a water pick device.
Yeah. So another question is, does gargling with slight heated salt water will go while going to bed can help?
Yes. See, salt is a natural antiseptic and antibacterial agent. Yes, going before going to bed, rinsing with warm salt water is always advisable. We recommend even on a day-to-day basis, people who are having gum disease, we recommend them to do warm salt water rinses. But having said that, if you are having worn out teeth, if your teeth are treated or if your teeth are chopped away, what happens is if you're taking warm salt water, again the temperature of the water can actually give you permanent sensitivity issues. So you should know when to use warm water, warm salt water, or normal salt water. If you're having sensitivity issues, it is better to use the normal salt water, or there are also over-the-counter mouthwashes available with chlorhexidine, cetylpyridine chloride, which are actually more antibacterial when compared to salt water. Yeah, but salt water can also be used.
So there is one more question, which is like, can we use power toothbrush for child? If so, then what age can we start?
You can use power toothbrush for children also. There are power toothbrushes specifically designed for children, again, smaller in the size and less number of bristles. But if you ask me, since the child's gums are still developing and still tender, I would advise not to use a power toothbrush until at least the child is 6 years old.
Or can you suggest us like the teach bleaching using home remedies become white teeth for whitening of teeth actually?
Yeah, bleaching is suggested, but again, there are multiple indications and contraindications involved in it. If you have a bad set of teeth that are crowded onto each other, or if you have receding gums, if you have gum disease, we wouldn't suggest bleaching. Bleaching ideally is suggested when you have a properly aligned set of teeth and there are no fractures, no chipping off. What happens is because bleaching uses hydrogen peroxide and some kind of acid, when it touches the gums or cracks, it will leave you having permanent sensitivity in your teeth. So unless and until it is a very uh, perfect set of case, we would not suggest you to go for bleaching. A dentist will obviously decide if it is a proper set of case or not when you go and visit for bleaching.
So Dr. Sai, thank you for answering all the questions. So here under the Q&A section, there are no further questions. So on behalf of everyone, I would like to thank you for sharing your invaluable expertise and insights with us for today. And I hope I wanted to extend my gratitude to all the attenders for joining us today and staying connected with us. Just before wrapping up this call, I just wanted to call out remember, a healthy smile is not just a reflection of a good oral hygiene, but also a key factor in overall well-being. So please, whatever tips that you have, whatever the tips that Dr. Sai has shared us with today, please utilize these tips in your daily routine oral hygiene and practice it and inculcate this habit of getting your dental routine checkups and dental hygiene routines on a daily basis so that you maintain a healthier and and a wonderful smile that you have. So until the next time, keep smiling bright and take care. See you on the another session on next Friday, sharp at 3:30. And thank you so much,
Thank you,
Dr.
everyone.
Sai.
Thank you for giving this opportunity. Thank you so much. It has been a lovely session. Take care. Have a good day, all of you.